All right. We are live on Facebook. Welcome back to the workflow with your boy Brown. Hey, it is now time to talk regenerative health, sexual wellness, and alternative pain therapy. Welcome. I got to welcome back a couple of old friends. Got to welcome back my friends Dawn, Jennifer, and Dr. Croft. It's been a while since I've had you guys on. How are you guys doing today?
Doing good.
Hey, thanks. Good to see you.
All right, now the last time I talked to you guys, it was about a year ago. You've now joined a new team. There's a new team with a couple new additions. So we're also going to welcome Matt and Alan to the conversation. This is the team from NuCell Regenerative for Health. What's going on, you guys?
Oh, we're doing well. Thank you.
All right, so tell me about this new team. Tell me about what you guys are doing now, and basically what's different from the last time I spoke to you guys.
Well, I guess I kind of am the catalyst for this whole movement, to be honest, Brown. So, the universe works in very mysterious ways and kind of directs us and guides us, and we really should listen. And in this case, I listened, and I had a tear in my shoulder, and didn't want to do surgery. I had no idea what was out there that was non-surgical in terms of options. And talked to a friend at my gym, and he told me about PRP. I had no idea what it was, but when he told me about it, it sounded really too good to be true, to be honest. It sounded too simple. You take my blood, you spin it down to the plasma, and you inject it into the area that's affected and injured, and it regenerates the area and mends the actual tear in the tendon. And I said, wow, that sounds a little too easy. Looked into it, Googled it, did some research, found out about it. And then 2 weeks later, I went and had it done. And 3 months after that, my rotator cuff tendon was completely healed. My shoulder was back to normal. I felt great. I was back to the gym, full strength. And I did a little PT while I was mending. And it all came together extremely well. And I got my shoulder back 100%. And we're able to do that at NuCell for all the joints of the body. But that led me to then meet Alan Taylor, who is the co-founder and my partner. And he actually, just a quick story about Alan. He saved my life. I mean, literally and figuratively with getting into this business. But he's my physician. He's my healer. And I went to him with I was pretty sick about a year ago, and I didn't know what the heck was going on. And within 1 or 2 visits, Alan was able to diagnose my issue, which was really kind of out of left field. And I thought he was nuts when he told me. It was mold toxicity. I had moved into a brand new building in Ardmore, Pennsylvania. And I got really sick, and he's, it was all sinus related and lung related, and I had rashes all over my body. It was just horrible. And he said, sounds like mold toxicity. And like I said, I thought he was nuts. So I had a mold company come out and test our apartment, and the levels were off the chart, and they deemed it uninhabitable to live there. So my wife and I had to pack up everything and move again. We had just moved into the building 4 months prior, but I kept getting sicker and sicker. And then once we finally diagnosed it, Alan said, first thing, get the hell out of there. Get out of there as quickly as you can. So we did, and then the healing began. And then, of course, I continued to see Alan and was able to continue the healing through his guidance. So when he then came to me and asked me about, based on my experience and my background as in franchising, he told me he had an idea for a franchise. And I said, I'd love to listen to it. I'm always open to any conversation about franchising. And he told me he wanted to train other healers to do the same modalities with the PRP and stem cells. And I said, well, that sounds great. It's a great idea. I said, let me think about it. And then I said, why don't we expand that to a couple of other options first? We'll open a clinic. We'll open our own clinic, provide those modalities ourselves. And then we can franchise that along with the training as 2 separate franchise options down the road. He agreed. And then COVID came along and we had to wait. We were going to be open the beginning of this year, but we made the corporate decision to wait and let things cool down a little bit, which they have to a certain extent. And so we opened up the clinic in October, and then about 2 weeks ago, Jen and Dawn came to the organization, and Alan knew them from another situation, and they came and joined us with Dr. Croft as well. He came with the group, obviously, and here we all are. So again, the universe provides, and we're exactly where we need to be and where we're supposed to be, and we're excited about it because we put some great people together to really bring healing to people that in many cases don't know that their own bodies can heal itself. We're kind of programmed in this country to take medication and get surgery. And those two things really aren't always necessary. Sometimes they are, but a lot of times they're not. So, we have a great team here, and we're looking to help many people in many different ways and give them healing opportunities that they never thought possible.
Oh, wow. Well, look, I know Dawn, I know Jennifer, and I know Dr. Croft from the last interview I had with them. We talked about gains wave technology. Now that you are all one team, what is new in your new team? What is it that you now are offering? What are you, as you move forward? What's the next piece of technology? What's next in regenerative health? Because people are concerned about their health. Especially in this last year or so with the pandemic, with everything that has been going on health wise. What is new for your new team, which is now NuCell Regenerative?
Well, I can take that to start and then hand off. It's an absolute joy to work at NuCell with this team because the therapies offered are much more extensive. We have alternative pain management. We have additional therapies for sexual wellness and sexual health, not just for men, but for women too. We also have aesthetics, and there's a lot of other treatment options that are available. And Alan's experience is extensive. We're talking about 15 years in regenerative medicine. So it's really a privilege to work with somebody this experienced, yet also with a heart of gold. And I would say that these areas all overlap. When we have clients who come to us for pain, they probably also have a need in another area. And especially since what you remember from us last time speaking on sexual wellness, 50% of these people are on way too many opioids, or they have an underlying medical condition that is over medicated, or they just can't get on top of in other ways. And so we can layer in these therapies and we can treat couples together. So it's really beautiful. Dawn, you want to pick up from there?
We also offer medical marijuana. We offer IV infusion drip therapy, which is really important. And I think Alan should actually talk about that because, he knows the process.
Sure. So my name's Alan Taylor. I'm a board certified physician assistant. I've been practicing for about 22 years. I started out in orthopedic oncology, and in orthopedic oncology, you quickly learn that tumors have their own blood supply. And so when you're operating on a large tumor and you or the surgeon makes an incision in what you think is normal anatomy is not normal anatomy. And so you have to learn quickly how to work as a team. And the patient's life really depends on you working as a team with your physician. And so over the course of my career, I've worked very closely in a team-oriented fashion with the wonderful physicians that I've worked with in the past. In any event, after about 10 years of doing the same thing and noticing there's no difference, I started to look for alternatives. And what I mean by that is you can go to the CDC website and look up how many people die from opioid overdose every year. And you'll find that it's more than 100,000 people a year. And so I began to think that writing prescriptions for people in pain with opioids really is just not working. And I started to think the same way about different surgeries and procedures. And really, I just kept my mind open and I looked for alternatives, things that made people better, that didn't hurt them. And that's really what I based my whole practice on now is finding ways to help people and really help people, without hurting them. And so that's the whole premise. And I met Matt, and after several rounds of golf, Matt and I came up with a NuCell, and it's been wonderful from there. Had a great time meeting Dr. Croth and Jen and Dawn, and it's a wonderful team. And just the other day, I looked at everybody in the eye and I said, we're going to make magic here. And that's what we're doing. We're making magic. And, I'll give you just one example. So I had a patient who had chronic obstructive pulmonary disease, and I treated him. When I originally saw him, his pulmonary function tests were very low. He was on oxygen. He couldn't breathe. He couldn't walk more than 5 feet. I treated him with stem cell therapy via IV and nebulizer. He went back to Manhattan and he got better. His pulmonologist couldn't believe he was still alive. He comes back to me a year later, and I'm treating him again. And my nurse happens to look at him and says, "Well, how long have you been smoking for?" And he says, "I never smoked a day in my life." And that got my attention. And I said, "Well, how'd you get COPD?" And he said, "I'm a musician, and I had a gig on 9/11 in Manhattan." And he was there when the towers fell, and this giant cloud of dust enveloped him, and he breathed it in for weeks, and it gave him severe end-stage COPD. And he got better, and he called me later and said, "I'm alive because of you." And I said, "Hey, we took a chance." I mean, and so that's just one example of what we do. And that goes along with sexual health too. It's very interesting, all of us, no matter what, when we get to a certain age, female hormones change and male hormones change. And it's very funny, nobody wants to talk about it, but men go through muscle atrophy and erectile dysfunction, and women go through, changes in hormones, estrogen and progesterone. And many marriages end because nobody wants to talk about it. So we treat men and women for sexual health and hormone replacement therapy and lots of alternatives. So it's really great.
So I'm not afraid to talk about it, as you know, Brown, because this is a relationship issue. And I don't know why, as a country, when we're obsessed with sex, we can't talk about it in the context of improved relationships, quality of life, better sleep, better immune system. I mean, a satisfying sex life, however someone happens to define that, is key to quality of life. And everyone is stuck at home right now. So it's a bigger issue than ever. And so I always like to talk about what the white elephant in the room is. And, the therapies that we offer at NuCell are for men and women. So wave therapy works for men and women. PRP injection works for men and women. Hormone replacement, and they can come in as couples. And I really like the discussion on wave therapy because it is a therapy that works everywhere in the body, not just the genitals. And I actually, probably Dr. Croft should talk about that. It's called shockwave therapy, wave therapy, EPET. Goes by a couple different names, but it's acoustic pressure wave therapy. And it does change the tissues in the body anywhere it's used. So it can be used to treat a lot of things in the body, but because it grows blood vessels and the other things that it does that Dr. Croft will talk about, it's ideal to work on genital tissue.
Okay. Well, before I bring you in here, let's talk about wave therapy, because I feel like there's almost a stigma to it, because just like Jennifer said, when you're bringing up sexual health, when you're bringing up sexual wellness, there's a stigma to it because you're trying to, I guess, for a lack of a better term, fix a situation. But
so
when you hear that, you feel like people just think that, okay, like I'm going to hand the doctor my genitals and they're just going to electrocute the problem out of it. That's what because when I
no, if we could do that, No. No. So I think Dr. Crosby would be great to answer that. But I do want to say that we have many patients who don't technically have a problem. Therapy will dissolve scar tissue. The therapy can be an enhancement. Athletes, biohackers, all of these things, because you're elevating the tissue. Women have no problem understanding that maintenance is a good thing. We do maintenance all the time. Men are shocked that at 50, at 50, they're not 18. Okay. No woman's shocked at 50 that she's not 18. So, but I do want to say we work on all ages. So go ahead, Dr. Croft.
Oh, okay. Thanks. So Brown, yeah, you're right. You know, people kind of get a little skittish about the idea of having somebody work on their body, especially, you know, genital zones and things like that. And especially when you hear the word shock waves. Nobody wants shocks near their genitals. So hopefully what I talk about can help clarify that a little bit. So, you know, as we were discussing, as we age, just in the process of living life, tissues age and become worn. We experience traumas, so tissues get damaged. And over time, they tend to not heal quite as easily. They tend to not clear out the byproducts and things as well. And that's where some of these other therapies come in, like EPAT, or what they call extracorporeal pulsed activation therapy. But basically, we're using sound waves, so there's no shocks that occur. It's just sound waves. And what's important about what this does, and one of the reasons I love working with this group is it's responsible for restoring what I would call the river of life. You restore blood flow, and that's important for injury repair, disease fighting, nutrient carrying, and even things like engorgement of genital tissues. Blood is essential, and we need blood to be able to pass through these tissues. So if we look at what EPAT does with these sound waves, as the sound waves pass through the tissue, it creates these little bubbles, micro bubbles. It's called a cavitation effect. And as these bubbles collapse, they create jets of force that stimulates tissues into breakdown of old tissues. So you get what's called apoptosis, or old cell breakdown, starting to clear out the old dead stuff. It increases cell permeability. So you're going to get nutrients into the cells, waste products out of the cells. In time, you start generating healthier cells that way. You also increase microcirculation. So lymphatics to help clear out the waste products, blood in stimulating release of growth hormones. So you start generating new blood vessels, new skin tissues, bone, collagen, all the things that can be damaged with wear and tear and age. Some other things that we see occurring, stimulation of what's called PCNA. It's a protein that's responsible for DNA replication and repair. So you're actually stimulating portions of the cell to do better at making healthier cells and healthier tissues.
Now,
go ahead.
Let me jump in for a second.
Sure.
Okay. A point that Jennifer had made is that both younger men and older men can benefit from this type of procedure. From this procedure, like, what is the difference? What can a younger man expect from an EPAT or wave therapy? What is it that most younger people look to achieve from getting this therapy?
Well, EPAT refers to using this wave therapy. It's exactly the same machine, just different attachments, different protocols. EPAT refers to doing this treatment on the body, anywhere on the body, shoulders, back, ankles, anywhere, okay, even aesthetically, because it does realign collagen fibers. So it can change the appearance of cellulite because it's working on the fascia, and it's also growing blood vessels. So EPAT is used for aesthetics in that way, and it's also used as an orthopedic aid, especially on feet, because it can dissolve scar tissue, it can eliminate pain, and it creates an inflammation on the site, which then the body will then come and treat. When we refer to it as wave therapy, we're referring to mostly male genitalia, but it also works on female genitalia. And young men who are healthy will see a spike in their erectile performance. And this can happen with just one treatment. So they might have a big weekend planned, they might have a crew, who knows? We're judgment free, but young men do come in for that spike, that enhancement, where they want, we call it a power play internally.
Oh,
they
if you're paying attention, look, you home. Valentine's Day is in like a month. You get this treatment. You go.
It will spike
Right.
nitric oxide levels. So it does spike nitric oxide levels, but just in the genitals.
Mm-hmm.
So, recreational use of Viagra is not really necessary with that full body response. You're just spiking it in the genitals. It'll also dissolve scar tissue. And guys who have sports injuries or some kind of trauma or just genetics, they can just suddenly develop scar tissue in their erectile tissue, and it really holds them back. Even young guys can have this. They don't want to date. They don't want to start relationships. An erection can be painful onset and in resolution. So there's other reasons why a younger, healthy male would consider this for biohacking in that regard. Predominantly, most of our clients are over 40, but I will say in this country, erectile, I like to call it dissatisfaction, not dysfunction. Erectile dissatisfaction is occurring at younger and younger ages. Some of it is medication related, some of it is health related, probably diet, okay, a lot of toxins in the body, but it is documented to be occurring at younger and younger ages.
Okay.
And some of those younger patients, it's injury.
Mm-hmm.
Yeah, some of them have injury.
Yep.
Well, a lot. I am getting a little bit of feedback. People are asking questions. Does wave therapy, in particular, does it help for stamina? I know you said it helps in erectile dysfunction and discomfort, but does it help for stamina, like lasting longer?
It can, and I believe that. So we do have patients who come to us with premature ejaculation, and they're concerned about that. There are protocols that can help with sensitivity. Mm-hmm. More likely, delayed ejaculation is something that would respond to it. Stamina can also refer to your refractory period. So a male could be looking to reduce his refractory period, and sometimes when they talk to Dawn and I, and we've talked to every man with every problem there is, and every code word for it, they might be referring to how long it's going to take them to achieve another usable erection. Okay, a usable erection in male terminology is strong enough for penetrative intercourse of any kind. So, if they want to reduce that from 24 hours to 8 hours or 8 hours to 2 hours, that's usually what they refer to for stamina. Scar tissue.
You guys can do that? You guys can do that? Are you saying this therapy can do that?
It's not us, it's the treatment. Okay.
Well, I mean, not you, like man.
Yeah.
Right. I'm back there, like that.
The wave treatment can do that. And what we like to do is what we tell patients what they need to know to get the most from the treatment. They can either follow our advice or not, but we give them home care to do. If they want to get the most out of this treatment and they follow the advice that Dawn and I give them, because we have a lot of practical experience, and our patients come back and talk to us and they tell us what works. So we have a whole regimen, and we often customize it, and we tell them what they need to do at home in between their treatments. And some of these things, I gotta say, getting off opioids okay, quitting smoking, balance out your nutrients, and all of these things are treatments that we do at NuCell. So instead of having a patient where they have multiple medical conditions and I'm recommending, hormone therapy from this person or that person, we can do it all under one umbrella here.
Mm-hmm.
I don't have to try to find somebody because Alan can look at them and fix all these pieces of the pie. Okay, so happy sexual functioning is a pie with a lot of different slices. The wave therapy changes body tissue. It's one slice of the pie, but it is a miraculous slice of pie because it grows blood vessels. It dissolves scar tissue. Nothing else is doing that.
Mm-hmm.
But patients need other solutions to layer in for success. It's the spiral up. And that's what we provide. We provide the spiral up.
Well, you also talked about services that you provide for men, but also women, and you also talked about aesthetics. Now, how does that fit in? How does aesthetics fit in with the treatments that you give and the services that you offer for women's sexual wellness?
So, I've been doing joints, tendons, ligaments, muscles. Probably the most famous person that you would know that had this therapy done, not by me, but by somebody in Germany, is Kobe Bryant. And Kobe Bryant went and had every single muscle in his body injected and came back and had the best NBA season of his entire career. So this therapy, some people say is new and experimental, when in actuality, they've been using it on racehorses for the last 40 years.
Mm-hmm.
And if you look at a racehorse compared to another horse, you'll notice a very drastic difference in terms of their muscles and stamina and so on and so forth. So after doing it for 12, 15 years for muscles, tendons, and joints, I decided to get into cosmetics. And I had additional training over several months and years, and we started bringing it into the cosmetic world. And so you can use it for hair restoration. You can use it to rejuvenate the skin on the face. You can use it to tighten up the collagen skin on the neck. You can tighten up the collagen in the breasts. And you can do it for sexual rejuvenation after and during or before the wave therapy. So in our clinic, we really offer a plethora of services, but all with the same thing in mind, and that's the health of the patient. And then from an overall point of view, we look at the body mass index, we look at the diet, we have physical therapy and a gym next to our facility that we can use it for. And we really, again, we look at the whole patient. There's many times I find patients with high blood pressure, and they're 30 pounds overweight. And I'd have to say, with COVID, 98% of my patients are 20 to 30 pounds overweight now. So, we definitely have, we look at the whole person, we look at their labs, we take a very good history and physical. We don't rush people out. Most people we spend an hour or more with, and we really go over their overall health. And that's why we get good results, because we're thorough.
People are surprised at the quality of the results that you can get with what's non-invasive and all natural. And the movement in aesthetics is away from this plastic surgery look. And what we offer is you're you, but you're just younger. It's a fresh, it's a youthful look, and it's less expensive, and it's non-invasive, and it's all natural.
The other thing I'd like to emphasize just real fast is, we've all been to the doctor's office, all of us, right? And so if you think about it, really nothing has changed in the last 50 years in the doctor's office. You walk through the front door, the furniture's a little old, it's a crowded waiting room. There's two girls at the front desk. They don't know whether to answer the phone or talk to you. Everybody's rushed. It's crowded. You're always waiting half an hour. It's 40 minutes behind time. The doctor's hurried. We've changed all that. We don't have a waiting room. You come into our clinic and it kind of looks like your living room. Everything's brand new. We wipe it down. We're very, compliant in terms of COVID. And we spend quality time with you. And that's why we get, great results, because, we're committed to excellence. Mm-hmm. And I made the comment the other day, I'll say it again, we make magic. We make magic happen. And that's really a cool part of something to be associated with.
All right. Well, look, you talk about making magic happen. We've heard about, I guess, the full gamut of what you guys offer. Of course, there are people who are going to hear about, performing better sexually. Of course, that's going to grab some attention. But also, I know you guys talked about, you've also dealt with medical marijuana. And that's also an elephant in the room, because people hear medical marijuana and they automatically think, hey, and get free weed or whatever.
They think Cheech and Chong.
They think that's exactly. They think Cheech and Chong. Well, that depends on how old they are. The older people, right. Younger people might think Red and Meth, Red Man and Method Man or whatever. But let me bring Dawn in, because I know that you have been involved in the legalization of marijuana since the very beginning. Why is that important into what NuCell Regenerative does?
Well, we offer a lot of alternative therapies for pain. There are specific qualifying medical conditions with the Department of Health. I have been helping patients for a really long time get their medical marijuana certification in Pennsylvania. I've firsthand seen some, amazing testimonials from, children with autism, parents that haven't slept in 10 years, and now they're able to sleep, throughout the night, and they're calling us crying because they're so excited because their kids are sleeping throughout the night. And, it's just, cancer patients, patients just in so much pain. The next year they call for their recertification, and I always ask them, especially if I know I'm the one who worked with them to begin with, how are you feeling? Has it helped you? What helped you? What forms are you taking? Are you CBD, more CBD, less THC, more THC, less CBD? A lot of patients, I feel like their main concern is, am I going to have to deal with the psychoactive effects of medical marijuana? And, there's so many options. You don't have to. And there's topical, there's topical relief creams that have THC in them, that in conjunction with, PRP or EPAT therapy. Every EPAT treatment I've done, I put a topical CBD cream on afterwards, because it's just so effective, and it always works. But as far as walking patients through the actual process of medical marijuana, I know you go on the Department of Health's website. I mean, God love them. I'm sure they've dealt with a million things, but it's confusing. And I don't want patients to feel like it's a confusing process. They can go to our website, NuCellRegen.com. We have all the steps laid out there. If they're confused about anything, I am there to help assist them every single step of the way. And I know Jen has also worked with medical marijuana and Dr. Croft. As far as the clinics go, Jen has, she's ran many marijuana clinics, and she gets asked a lot of questions. I don't know, what are some of the common questions you get asked, Jen?
Well, Pennsylvania's medical cannabis program, it's the number one confusing question I get, and I want to clear up a misconception. A lot of these patients coming through are our parents and our grandparents, okay? This is who is using this program, and it's critical because they have access to dispensaries, which are medicinal cannabis, okay? So it is strains grown specifically in Pennsylvania for specific purposes, with a multitude of delivery methods to bring the medication into the body with different formulas. But the number one misconception that I used to see is patients thinking that their doctor had to approve or that their doctor had to write a prescription. The law in Pennsylvania doesn't require that. If you have a medical condition that Pennsylvania has determined you qualify for medical marijuana, you qualify. So patients are afraid to speak to their doctor. Their doctor might be judgmental. They don't want to be shamed. They don't need to. All we need is your medical records. Your medical records document that you have one of the conditions, then it's your right as a Pennsylvania citizen to be approved and have access to a dispensary where it is medicinal. The pharmacist in a dispensary, medical marijuana dispensary, is a real pharmacist, but they have cannabis medicine training on top. And it's very complicated. Anyone who has read that cannabis Bible, Dawn, you know what I'm talking about.
Yes.
It's confusing. I mean, it's an enormous book. So you can get the help from in there. And the delivery methods, whether you're talking topical, which Dawn mentioned, and is the most underutilized pain treatment. And as long as it's not transdermal, it doesn't hit the bloodstream. You have no psychoactive effect. Mm-hmm. Within 10 minutes, migraines are gone. Okay. And so this is one of the things I noticed. And regarding our alternative pain management treatments, we also are launching a neurostimulator treatment. This is also non-opioid. And this is a treatment that I probably, maybe Dawn or Alan can talk about. But this is something covered by insurance. This is something covered by Medicare. Okay. It is very important in this area.
And you know, as you were saying, Jen, it's really important for, if you're really looking into getting a medical marijuana card in Pennsylvania, you know, you don't need a referral from your doctor, and you can call us. We'll help you, and you know, you're going to get your card in the mail. I think a lot of patients think that they come to the doctor's office, they're going to leave with a card, or if they do a telemedicine, they can come and pick the card up at the office. That's not how it works. You get your card from the Department of Health. So I just wanted to.
Right.
So Dawn, Jennifer, Alan, your team.
Active in this too.
I'm sorry.
Dr. Croft has been active in medical marijuana too, and also utilizes the EPAT treatment and the wave therapy. So these are therapies that we all have been doing
for years.
So Dr. Croft, I can come to NuCell Regenerative. I can come see you, and you will walk me through this process of I come to you with the issues that I have, the concerns that I have. You can walk me through this process of obtaining medical marijuana. I don't necessarily have to go to my general assistant.
Yeah,
absolutely. I think that is one of the best things that I've noticed since working with this group. You know, it's been Jen from day one, and eventually I met Dawn, and how they totally welcomed me into the process, destigmatized medical marijuana, and they were able to answer any question I had, no matter how ridiculous it seemed at first. They were just welcoming, open, encouraging. So I think that's one thing I'd like people to understand is pick up the phone and call them. Just ask. Ask anything, because they're knowledgeable, helpful, and willing to help you feel better.
And if we don't know the answer, I will get it.
Dawn will get it.
I will find out for you.
Dawn will get it.
If I don't know, I'll ask Dawn.
Hey, let me bring Matt back into this conversation. You were the one who's really helped make this team happy. You're hearing Dr. Croft, you're hearing Jennifer, you're hearing Dawn, you're hearing Alan talk about all the services that you offer. I mean, how impressed are people with this team that you have going on at NuCell Regenerative? See, I need therapy just getting that word out.
That's a mouthful. Yeah. Yeah, Alan and I feel really blessed. we feel blessed. Things happen for a reason. Things come together for a reason, and this team we just came together, and we love the fact that there's so many things that we can do that are adjuncts to what Alan and I had started with, primarily the healing effects of PRP and stem cells. So we're finding out all these other adjuncts to those modalities that you can add to the mix to make the healing process even more effective and efficient. So the more we do, the happier we are. Certainly, the more people we can help, the happier we are. And the fact that we have this great team together doing it is wonderful. And we're just now it's all about getting our name out there. And thank you for this opportunity to let us speak about all the things that we do, so people can hear about us, and hopefully we can come in and help us. We can help them once they find us. And I think there are so many things that we offer that can help, that people that come in with something that they may not even feel is something in our wheelhouse, it probably is. There's something we can do to help.
And if I can add something real quick to that, Matt, that's another thing I noticed about the concept at NuCell, is that all these therapies tend to restore and utilize the body's natural healing mechanisms. And I mean, that's the future of medicine, and they're on the cutting edge.
All right. Well, I'm hearing everything that you do. Oh, okay, I'm sorry. Go ahead, John.
Both ways. I didn't know about IV drip therapy until I came on board, and I learned about that from Alan. I had no idea of the impact that could have.
Well, let's bring Alan back in. What exactly is IV drips?
So it's very interesting. We have the ability to measure micronutrient levels in the body. And you can think of micronutrients basically as ingredients in a cake. Let's say we just take thyroid stimulating hormone. Your body needs certain ingredients to make thyroid stimulating hormone. And if you don't have those ingredients because of diet or malabsorption or other medications that you may be taking, you can develop a thyroid problem. Let's take other hormones within the body, estrogen, progesterone. Due to toxicity, you can have changes in your progesterone or estrogen levels. So we measure those levels, and then we're able to see how much zinc you have in your body, how much selenium you have, how much copper you have. And then if we find a deficiency, we're able to infuse those vitamins through an IV directly into your bloodstream. Let's say you're interested in boosting your immunity from COVID. We have a specific recipe of micronutrients that we mix up in a bag and directly put it into your bloodstream. You may have heard of a common thing to hear in the emergency room is, give the patient a banana bag. And a banana bag consists of certain IV vitamins to help people get through a drinking binge, consuming alcohol. Many alcoholics will be deficient in certain vitamins due to a poor diet or vomiting. People that have anorexia or bulimia, same thing. They're going to be micronutrient deficient. And so we have the ability to give you a 500 cc bag or a 250 cc bag of vitamins directly into the bloodstream. And it's really effective.
So Alan has therapies that way that can treat, conditions that people don't even realize are directly related to nutrient. And we're talking within an hour, because you're going right into the bloodstream. And depression, insomnia, diabetes, hypertension, anxiety, fatigue, headaches, these are things that can be rectified.
I'm pretty well known for taking patients off of medicines. And what I mean by that is, I take patients off of statins. I take young females off of benzodiazepines, and I treat them with micronutrients and diet change and exercise. and it's very effective.
It sounds effective. It sounds very effective, and also, because we're up against our time, but also know that you have a neurostimulator, and I know this is something new, and you said it's covered through most medical insurance. Could you tell me a little bit more about that?
Yeah, Dawn, you want to take that one?
So the neurostimulation therapy, again, treats an array of medical conditions, pain conditions. It alleviates those conditions. There's a little device that is placed behind the ear, and it's calibrated specific to a patient's medical condition. Alan actually does the installation for the neurostimulation therapy. So I don't know if you want to talk about how we can specifically calibrate the device for the pain alleviation, but I'll just give you an example. My mother, she has really, really bad tennis elbow. She uses her elbow every day at work, repetitive motion, and I have tried everything to try and help her. And this was kind of like a last ditch effort here to see if this would help her, and she loved it. She had it on. Alan put her stimulator on, and she's been pain free since she had it on. What was that? About a month ago, and it's a highly effective approach for pain relief. It's an FDA cleared Class 2 medical device with FDA and CMS approved protocols. So, Alan, I don't know if you just want to talk briefly about the patients that you.
Yeah, so it's minimally invasive. It's if you've had your ear pierced, it's about 10 times less than that. It's 4 little probes. I can barely see them unless I have my glasses on. They go in the peripheral tissue of the ear. It's mapped out via an algorithm with a computer based on the patient's history and physical exam. And it's powered by a battery, and it's got a computer in it, and it pulses for 3 to 4 hours, and then it turns off, and then it turns back on, and it pulses, and it does that over a course of 12 days, and then we remove it.
Okay, so it's something that you keep on your ear, like you apply it behind the ear.
It's temporary, but it'll provide 4 to 6 months of pain relief. And
Okay.
we're talking full body because this is, so we're talking chronic conditions.
Mm-hmm. Now, for people who might be intimidated, they're hearing something that like you have to apply something behind your ear. Is it something that's is it very noticeable? Like for me, I don't have long hair, so if you put it behind my ears, are people going to be able to see it?
Yes and no. I mean, yeah, we tegaderm it down. We put protective plastic coating over top of it.
Mm-hmm.
So, I mean, the good news is it's not going to kill you.
Well, that's great news. Right?
Yeah.
That's good to hear.
And I can tell you,
That's all I needed to hear.
people in pain, it's so effective. Nobody complains about it.
No.
How soon do people feel results? Like, how soon after you apply the neurostimulator behind their ear do people start to feel better?
Some people feel it immediately.
I was just going to
Really?
say.
Okay.
Yeah. We don't promise that, but some people do. And the results are cumulative. So insurance might cover 2 or 4 per year. We encourage patients to come back and have all of those because with every application, the results are better and better.
Mm-hmm. Okay.
And not only that, it has side effects of reduced anxiety, reduced depression, reduced cravings, better sleep, weight management. Those are not qualifying conditions to be covered by insurance, but they are side effects that are very positive, especially when someone has PTSD or a whole array of issues.
Okay. Well, look, we presented the listeners and our watchers a lot of different services that you guys offer. Now, I gotta ask, can my listeners, can my audience, do you have a special offer for my audience who would like to hear more about what you guys have to offer?
Of course we do.
Nice.
Of course we do.
Nice.
Look, we're easy to get along with. Alan does telehealth consults or he does in-person consults. It depends on the patient's comfort level. We have a Valentine's special. Of course we do, since we do work with a lot of couples. So we can do couples IV therapy, buy one, get one half off. If a patient wants to come in and do wave therapy, it's $100 off the package. We'll probably have other ones, but I really feel like the home run is the consult with Alan. He cares and he spends time with you. And his background of experience is just enormous.
Awesome. Well, look, how can people get in contact with you? They've heard the offers. They heard what you do. They want to hear more. How do they get in contact with everyone at NuCell?
Alan, that's your invitation.
You can go to NuCellRegen.com. We have a lot of information on there. And you can also give us a call. For the medical marijuana program, you can reach me at 267-207-5733.
That ain't your personal phone number, is it? That's not your personal phone number. People want some medical marijuana.
No, that's medical marijuana certification.
All right, they're not calling you.
They're not calling me.
All right, just trying to make sure, okay?
Mm-hmm.
But get that. But real quick, get that number one more time.
It's 267-204, not 7. 267-204-5733.
All right. Well, look, once again, if you're interested in hearing, if you're interested in a free consultation, Alan, Dawn, Jennifer, they'll sit down with you. They will talk to you about what they have to offer, the services that they have to offer. All right. NuCell Regenerative. Like I said it. There you go.
You actually got it right. Good job.
NuCell Regenerative Health.
People should go to the website. We have videos on there. We have testimonials on there. We have all the information. So it's NuCellRegen.com. Just go to the website. You can book everything right through there.
And NuCell, we have to make sure we spell it properly. NuCell.
NuCell Regen.com.
Yep.
.com.
John, maybe you could put a link to that to our website.
Oh yeah, we gonna have some links. We're gonna make sure to give you guys a call. People need to hear about this. Get your consultations. Talk to Dawn. Talk to Jennifer. Talk to Alan, Matt, Dr. Cross. Thank you guys for coming in. Thank you guys for joining me. It's always
Thank you. Thanks for having us every time. It was great to see you again.
Last time we were here, we offered to do treatment with you, and you did not take us up on it.
No, didn't take us up on it.
See, now I get.
But now we have more to offer you.
Now you have more to offer. Does I get? I get like double the hookups then. I get 2 consultations.
2 consultations.
Two consultations and a bag of medical marijuana. No, I'm just joking.
Bring a friend.
I'm gonna bring my wife. I'm gonna talk you about that. Valentine's Day is coming up. I got to get things right.
That's right. Remember that.
In the house for like 10 months. Trying to get things right. All right, the team from NuCell Regen for Health. Thank you guys. I appreciate it.
Thank you.
Right. We'll see you guys next time.
Take care, everybody.
All right.
Bye-bye.
Peace and love. Thank you.
Stay safe.